Dr. Cora Taylor and I would like to present Care for Children with Special Needs During Emergencies. This is a training for first responders and community professionals. This webinar is designed for first responders, frontline workers, and community professionals. It is part of a collection of materials and trainings to support children with special needs during emergencies. This program was provided in part by the generosity of the Rite Aid Foundation. My name is Barbara Haas-Gibler. I'm a board-certified behavior analyst, and I'm the Director of Education and Behavioral Outreach at Geisinger's Autism and Developmental Medicine Institute in Lewisburg, Pennsylvania.
My name is Cora Taylor, and I'm a psychologist and assistant professor at Geisinger's Autism and Developmental Medicine Institute. I want to start out talking today about why this information is important. And the biggest reason why it's important is that childhood developmental and behavioral disorders are common. There are about 12 to 15% of children are affected by a developmental disability, including things like autism, speech and language disorders, and a small percentage also affected by more significant delays called intellectual disabilities. Also, many children are affected by behavioral and psychiatric disorders like ADHD or anxiety. So in terms of whether or not you are going to meet a child with a developmental disability in the context of an emergency, it's really not a question of if you're going to encounter a child with a disability or a behavioral disorder during an emergency, but when it's going to happen. We also want to note that a lot of the strategies described in the presentation today are not just for children with disabilities, but also other behavioral concerns, especially children who are very anxious, often will benefit from these strategies. First, let's talk briefly about autism spectrum disorder. Autism occurs in about 1 to 2% of the population, with symptoms first occurring in early childhood or the developmental period. Generally, it is more commonly seen in boys, although girls are also diagnosed with autism. The symptoms of autism vary greatly from person to person in both the types of symptoms and also the severity of those symptoms, with some individuals very mildly affected and others presenting with very significant disabilities. One important thing to know about autism as a first responder is that elopement or wandering off is a relatively common concern. When children with autism elope, there is a risk of harm, and the most common risk is drowning. So if you encounter a child with autism who elopes often, helping them or their family access swimming lessons is one of the most impactful things you can do to protect their safety, in addition to securing their home. Intellectual disability also occurs in about 1% of the population. Many individuals with intellectual disability may also have a known genetic cause of their intellectual disability, such as Fragile X or Down syndrome. There is a wide spectrum of severity for intellectual disability as well, that ranges from mild, which is the most common, to profound. Individuals with severe to profound intellectual disability generally have very significant deficits in communication and daily living skills, and some may also have severe motor difficulties. Regardless of the diagnosis, there are some issues that are common in individuals with developmental disabilities that you should generally be aware of. The first is receptive language, which is the ability to understand what other people say, and this may be impaired in many individuals with developmental disabilities. Many, while they're able to understand some language, may not understand more complex directions, and simplifying your language to just 1 or 2 word directions might be helpful. In addition, some individuals may struggle with expressive language or using their own words to communicate. Sensory differences, although often associated with autism, are actually very common in many individuals with disabilities, not just autism. So it's always important to be aware of how the sensory environment may be influencing their behavior. We see both over and under sensitivity to sensory input, and some individuals may have a combination of being oversensitive to some input and undersensitive to others. When addressing an emergency, you're generally approaching a situation that's very unfamiliar to many or most of the individuals involved, and this may cause fear and increased anxiety. In some cases, especially those who struggle to communicate, this anxiety and fear may manifest as self-injury or aggression. One of the most important things that we want you to take away from this presentation is the idea that the best defense is a good offense. Just meaning that instead of just planning to be reactive when you do run into an individual with a disability who maybe is struggling during an emergency situation, trying to prepare up front, knowing that this situation is likely to happen at some point, is the best way to be prepared. The first thing that you can do is just to create a kit that you can keep with you in order to be ready when you do encounter a child with a disability who's struggling, or a child who's struggling in general, who maybe is just anxious, even if they don't have a diagnosis. You don't necessarily need to know what the child's diagnosis is in order to have a toolkit of things that might be helpful. So some things that you might consider including in a kit would be a whiteboard with a marker for communication. You can either use this to write words or draw pictures about what's going to happen, but if you have a child who struggles to communicate, they may be able to communicate with you through writing. Having picture symbols to show individuals with both words and pictures what's going to happen. Bubbles are a good tool to help children calm. Headphones for loud noises, having a small stuffed animal or other prizes that children can hold or you can use to demonstrate what's about to happen. Fidget toys can be helpful. Having a video or a music player for calming, a toy for modeling, and then also a timer so that you can tell a child when something is going to be over or how long something's going to last. If you do encounter a child, make sure you're checking their wrist, their neck,
and their shoes for an identification or GPS tracking device. Those are common places where you might find that type of equipment.
The following are practical strategies you can utilize when dealing with special needs children in an emergency. Timers are very useful, especially with children with special needs, in letting a person know that something is finished. Using that signal, that's something that when the timer goes off, good things are coming, such as we will be done, you can go home, you can have your promised reinforcer. Some children respond to a count or a countdown. And if you don't have a timer with you, then just use your cell phone. Visual supports. So there are many types of visual supports, and many students with special needs are familiar with these in their school therapy, in speech, and in their classrooms. So oftentimes for you, you could even use something as simple as a whiteboard with markers, making a written list and checking off, showing that things are getting done. In some children's case, draw a quick picture of something. And other times, if it's available, you could use pictures from a familiar board, either from the classroom teacher or the parent or the caregiver. What's also very helpful and have been utilized quite successfully with children with special needs are if-then visuals. This is a picture of a visual support that you potentially could utilize with showing the person what is coming next or what you're going to be doing. They could also be utilized showing that first this, then this. So in this case, we have actually a mask. If you wear your mask, then you are going to have a reinforcer, or then we're going outside, then we're going to take a break. So you could utilize those pictures from the previous screen and use those as if you have your blood pressure taken, then you're going to be finished or you're going to have a break. There are many types of communication, and we think about unaided, meaning facial expression, the way you vocalize, a gesture, or actually sign language. When we think about aided communication, that would be the use of an iPad or a tablet, a single message button. It's called like a MAC switch, and it might just say, take a break, or I need help, or go outside. Or we have some individuals that will use a picture exchange communication system. So actually using pictures of items and providing that to the person as a form of their communication to indicate what they want and or need. It's very helpful that even if you do not know, if the person that you're working with with special needs may not be utilizing sign, they may very well receive sign, just as we have receptive language skills that may be different than our expressive language skills. So common signs that potentially could be utilized when you are in an emergency situation and responding to a child with special needs or an adult would be the sign for stop, more, or help. These are just a few. During an emergency, first think about assessing the scene and making a plan, weighing those benefits and risks of approaching quickly versus cautiously. Talk to any of familiar adults on the scene before approaching the child or adult. Speak firmly but calmly. Talking less, shortening your directions to 1 to 3 words is often helpful. Make your adjustments as needed, depending on the person that you're communicating with. If a caregiver is present and you need to take a person in the ambulance, please invite them to come into the ambulance if needed. Consult your caregiver on all your actions as appropriate. And it could be, if it's in a school situation, it could be the teacher or a paraprofessional, or it could be a behavioral therapist that is there supporting the individual. I utilize this one because it reminds me of a young boy in the dental office who we needed to cover the signage on the x-ray machine because that's what will trigger for him. Just keep in mind to keep your medical equipment, syringes especially, out of sight, especially if it's not needed or until you're going to need it. Keeping sounds to a minimum, for example, if you're using a walkie-talkie or phones, keeping those sounds down. Keep sirens and lights off if possible, and talk calmly between staff members and monitor what you're saying to each other. Frequent flyers are children who often are engaging with first responders due to their complex medical conditions, seizure activity, for example, severe behavioral problems, or injuries due to impulsivity, or pica behavior, eating inedibles. If in these cases you're going to be seeing an individual more than one time, then what is really important is to engage with the parents and the school proactively. Potentially a person such as myself, a behavior specialist, could be involved in providing care, could work with you to come up with some strategies that would be successful, and or help personalize some storybooks, social stories, or picture books to explain better what is going to be happening during these procedures or when they're inpatient or in an ambulance. As mentioned in the previous slide, if you're going to be seeing a young child or a young adult more than on one occasion, it might be helpful to have a social story prepared that helps to, these are short, personally written, child-friendly stories that help describe difficult or fearful situations, going to a doctor's office, emergency room, riding in an ambulance. These are very fearful and difficult situations for typical children, no less children with special needs. Social stories really help clarify what's going on and how the person can respond. I can ask for my mom to hold my hand when I'm in the ambulance. I had a young girl that for an x-ray, we did a social story ahead of time, and she could bring her stuffed animals, and the staff knew that she liked stuffed animals, particularly cats, so they were prepared to show her when she arrived a picture of a stuffed animal of a cat. Social stories explains how adults will respond or feel. My mother will be proud of me for sitting still. I may earn a prize, for example. They're usually written by parents, teachers, or staff. And really what we do is you ask them for the support persons for help if you have a frequent flyer. In the next slides, we will have some scenarios of potential situations where an emergency responder or team may be called to assist with a child with special needs. When we think about responding to a combative child, so this could be a scenario that we think about. Bobby's a boy who's in a full-time autistic support classroom in a public school. He has a full-time aide who works with him throughout the day. His favorite class is gym class, and today there was a substitute. He started hitting his aide. He's not de-escalating, and he's not responding to coping strategies that had previously worked. This first scenario is about responding to this competitive. Per the school policy and this crisis plan, the teacher and the aide called the school resource officer, who helped escort the student to a designated room in the building. Then, in addition, in the plan, the parent, the police, and EMT have been called. This has been in plan when the de-escalation techniques haven't worked and the incident has necessitated a physical restraint. This young man has been in an approved restraint for 20 minutes, and the school nurse has been present as well. The crisis plan should also clarify the roles of the first responders and establish communication between responders and who will approach the student first. We should have in that plan determine the school entrance to meet the school staff who will escort the responders to the student's location. When arriving on the scene, it's very important to figure out which staff member knows the student best, assess whether or not the staff is injured, do staff or children need medical attention. The school nurse in this case probably was present because whenever there's a restraint of certain, in schools many times, the school nurse should be present. It's very important very quickly to know, does this child have any medical conditions and take medications? How does this student communicate? Does he use sign? Does he use pictures, verbal, or using just natural gestures? Does the student have any favorite toys or songs that could be used as distractors? The other question is has the child been restrained and for how long? Asking whether the child's parents or caregivers will be available by phone or are they on the way to the school. Some children have a pre-existing consent for a PRN of a medication administration such as Ativan. Clarify where the child should be transported, to the home or the emergency room. Do not restrain the child further unless using a recommended technique and only if necessary. Be cautious about rewarding the negative behavior, giving more attention to aggression than to when the child is being quiet or trying to communicate. Use a no-nonsense approach. Using your other resources would be very helpful, especially if they're something familiar to the student, an if-then board. So if you have a picture of blood pressure first, if then next comes something else. The visual supports, using a checklist, modeling, using a stuffed animal, showing what you're going to be doing to the person before touching the child or adult, using a distraction with fidgets or sensory toys, or as previously mentioned, talking about something that the child likes or singing songs. The staff and or family and caregiver should be able to provide you with some of these ideas. If this child is a potential frequent flyer due to impulsivity or aggressive behavior, it's really important to debrief with all the parties involved, the EMT, the police, the parent, the school personnel, outside behavioral health providers. What went well? Was the plan well executed? Did people forget that they should have had a different designated area for EMT versus the police? What went wrong? Too quick of an approach, not aware that the child was on medication. These are things to take into consideration. This is the time to review and update the crisis plan.
So here's another scenario. In this situation, you're responding to a severely impaired child. So here's the situation. You're at the scene of a car accident, and when you arrive, you're approached by a passenger from one of the vehicles involved in the crash. She tells you that there's a child in the back seat of the car who has autism and is nonverbal. You can see that he is screaming and hitting his head with his hand. So in this scenario, you should try to capitalize on this information that is being given to you and also ask if this individual might know more information. Assuming it's safe to wait, ask for additional information such as the basics of the child's name and age, other medical condition, and again, remember that children with special needs may wear identification on their shoes. Ask about how they communicate. So we know they're nonverbal from that initial piece of information, but we don't know if they might use another way to communicate. Do they use sign language, or do they have a device such as an app on an iPad or a picture exchange system that they use to communicate? That can be very important. Remember that self-injury or aggression, in this case hitting his head, is communication. In this situation, this child might be communicating that he's distressed. In addition, even if you don't have this information, always use sign language for signs that you know. Even if a child does not engage in sign language, often children with disabilities have been exposed to sign language. So if you can sign for just simple things like more, stop, all done, that can be helpful to increase the chances that the child will understand what you are trying to tell them. You might also want to ask this knowledgeable caregiver about preferred items or rewards that this child may like, but you can also start looking for clues. So if the child is wearing a shirt, shoes, or a backpack that has certain characters on it, that might be a very good indication of what some of their preferred shows or activities are. And also, sometimes it's important to stay current. Even if you don't have kids, ask relatives or neighbors what the current or popular shows are for a range of ages so that you know what to fall back on. So right now, PJ Masks, Paw Patrol are really, really popular in a younger age range. But even if you don't have kids in that age range, you might be able to identify that this is popular just by paying attention to the kids around you. At older ages, you might know Fortnite and Minecraft are popular. Also, knowing popular sports teams and players, both local, national, and international, can help give you something to distract the child or talk about during a stressful situation. Always remember to fall back on your resources. Anything that you have in your emergency kit or any of the strategies that we talked about earlier in the presentation can be helpful. So use the if-then boards, use your visual supports, model what you're going to do on a stuffed animal or other toy that you have, and use distraction with fidget toys or sensory toys to help the child focus on something other than the situation that's happening. Like we've talked about earlier in this presentation, these strategies are not only for children with disabilities, but can be helpful for anyone, child or adult, who is very anxious about the situation. This is an emergency. Many individuals don't know what to expect, and that can be very stressful even on typically developing children and even typical adults. So don't forget these strategies just because you're not working with a child or an adult who has a disability. So in this next scenario, you're responding to an anxious child. So in this situation, you have a 4-year-old child who's brought to the emergency room by his parents. He has a 1-inch cut on his leg after falling at the playground. His parent thinks he might need stitches, but he's refusing to let you examine the wound. The child is crying and in extreme distress. The parents tell you that he was recently evaluated, but that he doesn't have autism. Remember, that last piece of information isn't as important. The important thing to remember is that this child is very anxious, and the tools in your toolkit can be helpful. So go back to your toolkit. Use the same strategies that you might use with an individual with a disability. If you're able to, give the child time to calm and adjust to the new environment. So coming into a doctor's office wearing a white coat in a busy environment might be really stressful for a child, and giving them just a few minutes to calm can be very, very helpful. Make sure that you're always keeping the child updated about what you're going to do. Let them know that you are going to approach them before coming near. Make sure to use your distraction strategies. So again, look for clues about the child's preferred shows or characters or movies, or just ask their parents if they're there in the emergency room. Trying to share a child-friendly version of the plan of care, like a visual schedule or a checklist. If the child can, you can let them engage in crossing off the items as they're done and making sure that you're building in rewards. And so they know that at the end of this, they might be able to get a prize. In addition to the strategies that we've talked about, there are other resources. Our center at the Geisinger Autism and Developmental Medicine Institute is a resource. There are also GPS and tracking systems. We talked briefly about elopement, and there are a few resources for this, such as Angel Sense and Project Lifesaver. There are several police agencies in our area that support Project Lifesaver. Smart 911 locally is only available in Luzerne County, but consider working with your police and emergency department to advocate for Smart 911 in your community. There's also a resource online called the Big Red Toolkit, which is useful especially for caregivers to help them prepare for an emergency. We hope this presentation will help you feel more prepared the next time that you encounter an individual with a disability during an emergency. Thank you for your attention, and if you have any questions, please reach out to us.